Welcome all. Thank you for joining us this evening. We have a great panel for you. Hope that you find it informative and you get something out of it. My name is Liz Sinclair. I am the Community Relations Coordinator at AcademicsWest, and I'm going to be moderating tonight. I guess I can introduce our three panel for all of you. I'll start with Dr. Evan Flamenbaum. He is the head of school of AcademicsWest. Dr. Flamenbaum is an advocate for children, adolescents, and young adults who experience mental health and academic issues. He holds a doctorate in clinical social work as well as master's in school counseling. As a former dean of students at a prestigious private school, he used his clinical knowledge to help students stay in school during periods of difficult psychological adjustment. As the current head of school of AcademicsWest and co-founder of TherapyWest, Dr. Flamenbaum continues to integrate his clinical knowledge and background in education to train and guide professionals and parents. He is a nationally recognized lecturer and considered an expert on the treatment of learning issues and ADHD. Dr. Flamenbaum also created Clinically Informed Academics, CIA, a research-based model that provides a framework to improve the overall functioning of students socially, emotionally, and educationally. We also have Dr. Auciello. Dominick is a neuropsychologist providing neuropsychological assessments to preschoolers through young adults with learning and psychiatric issues. His primary goals are to provide families with thorough evaluations, timely reports written in user-friendly language, and a willingness to collaborate with school personnel and other professionals who may be working with their child. Following a combined 15 years of experience at the NYU Child Study Center and Child Mind Institute, he has a broad-based understanding of the many issues that our children, teens, and young adults may face. Dominick has extensive experience helping families and those professionals working with them to determine and secure appropriate educational settings for their children and to decide upon a suitable plan for therapies and related services, as well as to establish specific strategies and accommodations to help students succeed. He specializes in designing individualized education plans that connect kids with varying personalities, learning styles, and mental health conditions. Dominick's education plans are based on the most current science we have on learning and interventions, and his reports are comprehensive, easy to understand, and contain recommendations that can be implemented by teachers and parents. And we also, lastly, have special ed attorney Adam Dayan. Adam's interest in special education was sparked by his research on autism as an undergrad student and enhanced by his fundraising efforts directed through the education of individuals with autism. Adam began his legal career as an associate at a law firm known for its work in the area of special education law. He moved on from that position in 2009 to establish his own law practice, which is based in downtown Manhattan, focusing on representing individuals with a wide range of special needs. Over the last 12 years, the law offices of Adam Dayan has become one of the premier boutique special ed law practices in New York City. In addition to offering legal services in the areas of special education law, the firm offers trust and estate planning services to its clients to make sure that children with special needs receive long-term financial security as well as a quality education. The firm consists of a dynamic legal and administrative team that has earned a reputation for exceptional results and outstanding client service. Adam holds a JD from Yeshiva University, Benjamin N. Cardozo School of Law. He also holds a BBA from CUNY Baruch College, where he graduated summa cum laude and was a Hertog Scholar and a member of the first graduating class of the Macaulay Honors College. He is admitted to practice law in New York, as well as in the U.S. District Court of the Southern and Eastern Districts of New York. He resides in Manhattan with his wife. They share an interest in travel, foreign language, and education, and they are having a blast raising their 4-year-old daughter and 2-year-old twin boys. So thank you all for joining us tonight. I'm going to let some more people in as I was reading that. But I think we'll take it away. And Dr. F, I think you're first up, so.
Okay, thanks, Liz.
Sure.
So looks like you have one or two people coming in. So first of all, it's knowing some of the people attending, we have a nice mix. It looks of professionals, parents. So I'm really hoping my real goal tonight, I think the whole panel, our goal is that we end this with a dynamic discussion. But thank you all for attending. I appreciate your time. So I've been thinking about this for a while, and with the rest of the panel, we've been talking about this for the last couple of months, been discussing the impact of the pandemic on learning and mental health. And Liz, who works for me, I'm the head of school of a therapeutic day school. And so we're sort of uniquely positioned to really look at and figure out how to deal with on an ongoing and real-time basis the impact of mental health and learning due to the sort of the pandemic. And I remember, talking about this last spring, thinking we don't have to have this conversation anymore. We're done. Well, I went to a Knicks game. I took off my mask. And so Mother Nature keeps on moving the goalposts, and it just keeps on forcing us and young people to continue to rehabituate to the pandemic. So I'm going to kick this off by just framing a bunch of general issues. And then Dr. Auciello is going to sort of look at this through a neuropsychological lens. And Adam, who is an attorney who specializes in educational law, is going to look at it from his perspective. And I hope that from that sort of surrounding view from different perspectives, we can really initiate a dynamic discussion at the end. So all of us who work with children in educational settings, just one of the things that we have seen, which is really well documented, is what was the impact of reduced learning time? Kids had less time on task to learn. The delivery of education was just pervasively diminished. And so one of the things that we're finding, again, I'm just pointing out some of the things that the research is saying that we need to focus on, and we can talk about from different points of view how to get there. We have to make up this time. And, so enrichment programs, summer learning have become incredibly important things. We have to figure out how to track the kids and make up a lot of reduced learning time. We're also seeing, just on our own program in practice, because we also have an outpatient treatment practice, many students of all ages simply just fizzling out and disengaging from the learning process. Simply a growing number of students that maybe 2 years ago would have certainly not been seeking a clinical school, a therapeutic day program like ours, they are now. And so what we've seen is the pandemic has been sort of the great amplifier. If you had some anxiety beforehand, it got bigger. You had some mood issues, they got bigger. Anything that we saw were sort of moderate issues clinically, for many kids, they really became tremendously magnified. So there is, and I just asked Adam right before this, that, hey, are you seeing more kids seeking placements and needing to, utilize user services in terms of DOE placement? And the answer is yes, more people are looking for private school placements. And we need to find, there's an increasing need for more specialized schools and programs to meet these current needs. The DOE, again, talk about amplification, was already having a very hard time meeting the needs of a lot of students, and now that's even gotten worse. And there's been a lot of research that has extrapolated from what we used to call the summer slide. So every summer, kids regress. They haven't been in school for a couple of months, and their reading levels tend to go down. Actually, math tends to regress even more substantively than reading. So if you can take those 2 months, and then I remember after the first year of the pandemic, the research was coming out that generally speaking, on average, kids were about 5 months down in math, and I think 4 months down in reading. So where are we now? So we have to assume that there's a tremendous amount of scatter in terms of kids' levels. My son, who is going to be a freshman in college next year, I can just see kids going to college at like the 11th grade level, the 12th grade level, maybe some are even more in the sophomore year in terms of how much they've gotten. I also think you're going to see kids applying to college and even high school at varying ages, just because there's so many kids out of sync and off track. So what we're seeing is we assess kids ourselves all the time, and we're seeing just kids coming in with greater disparity of where they typically would be in the past. So the broad scope of the issue is that diagnostic tests, and Dominick's going to obviously talk much more deeply about neuropsychological testing, diagnostic tests and effective interventions have to be used to determine where kids are at. I'm going to be kind of planting seeds throughout my few minutes here, just to hopefully induce some people to start thinking and asking questions at the end. For those of you who are in the field or have kids, how much are you seeing programs doing academic assessment? What are people's experiences? It's rhetorical at this point, but think about it. I hope we can talk about it. We must assess our kids because then we can develop an intervention plan because we know where they're at and where they need to be. The pandemic has also clearly highlighted various inequalities. So it's very evident that there are significant gaps in access to necessary resources that support and enhance learning and development. So I always think hierarchy of needs. If you're looking for, if your needs are food, shelter, healthcare, financial relief, you're less concerned about, getting your kid maybe on Zoom. And so again, those sort of disparities became tremendously highlighted. Obviously, that's part of political discourse, but it's a significant problem in terms of education and welfare of young people. The pandemic has also really highlighted an unequal access to technology, this sort of digital divide. So again, we really, first of all, on a positive note, I think we realize there's a lot we can do using technology that allowed us to keep a lot of things going. Obviously, people working and kids in school remotely, but the digital divide has to be bridged. And I know that's on the political agenda, as are a gazillion other things, but I'm really hoping that one of the positive outcomes is that we realize that and that there's less disparity in terms of access to digital resources. The White House, actually, if you look, they publish a lot of information, and it looks like they do a lot of sort of robust research on this, on the impact the pandemic has had on vulnerable populations. This is from the Office for Civil Rights, and so I kind of look at it from time to time because they really highlight some of the things I'm seeing professionally in our school, and again, I want to hear what other people are experiencing themselves. So for many elementary and secondary school students with disabilities, COVID-19 has really, really disrupted their education and related aids, all the related services that you can get from school, which are needed to support academic progress and prevent regression. There are a lot of signs that those disruptions may be exacerbating longstanding disability-based disparities in academic achievement. So again, another group which they've been really, we are seeing, again, we are not maybe a representative example of the world because we look for a certain population, but we are seeing a lot of, the LGBTQ plus population has been disproportionately impacted by the pandemic itself, especially in terms of less support than they normally would have had. So they have lost regular access to affirming student organizations, supportive peers and teachers and school staff, and these students are also at an increased risk of isolation and abuse from unsupportive family members. Again, that's what they're saying, that's what I'm seeing. The other thing that we've noticed that I don't see people talking a lot about is developmental regression. And so we're talking about the kid who was potty trained that maybe isn't anymore, the young kid who, had fluid speech is now talking more baby talk. It could be the 8-year-old that really was sort of more regulated in terms of their motor activity, who's now no longer able to sit still. The 15-year-old ASD student who worked so hard in therapy to acquire, certain levels of speech is now losing gains. And I'm seeing this talking to people all over, the easygoing junior in high school who all of a sudden is now exhibiting angry outbursts. So talking to heads of school and people in different programs and schools all over New York and certainly other places, they're seeing a lot of increase in externalizing disruptive behavior. Our kids are really showing it more now than they ever have. Regression is a natural part of development. As most children encounter new and challenging tests they need to master, they often struggle and express their frustration and duress. I mean, Adam, you got young kids. Every time they've had to learn something, they go through this kind of period of disorganization and dysregulation, but then they figure it out. That's typical. Nonetheless, they typically can reset and return. That's what we expect. There are times, and I'm seeing more and more of them, however, when regression is atypical and children are regressing in a more pervasive and acute manner. I also am seeing just a lot of social emotional regression. The way we develop socially is through our family and exposure to friends, just young people having less exposure to the people that normally facilitate their development. This has gone on. We're in the third year. It's having an impact. And people I'm talking to in residential programs, more higher acuity populations, they're really seeing that in a lot of really interesting and concerning ways. So we are all experiencing prolonged stress. We humans are built for short-term stress. It's our way of sort of problem solving and getting out of a tough situation. Long-term stress can lead to a variety of physiological, cognitive, and psychological issues. So how many people listening tonight have experienced things like sleep disturbance, new aches and pains, or some sort of impairment in their executive functioning? I actually have to go to my oral surgeon tomorrow. I ground my teeth so hard for the first year of the pandemic. I have to get 2 implants, which is only matched by the pain of me having to pay this person that amount of money to fix it. But this is what I'm seeing. Parents, caregivers, everybody is experiencing some amount of duress. So if we're experiencing it, what's it like for our kids? What's it like for young people who are particularly vulnerable to those issues? So according to the National Institute of Mental Health, an estimated 31.9% of young people ages 13 to 18, so adolescents, experience an anxiety disorder in their lifetime. So a lifetime prevalence of almost 32%, which is really, it always stuns me how high that is. Since the start of the pandemic, the prevalence of anxiety and related mental health disorders has increased globally. It is not surprising that the effects of the global pandemic, think about the social isolation, the constant significant changes in routine, which are the things that really regulate so many of us, have markedly increased rates of anxiety, especially as school resumed this year, as well as due to the Omicron variant. So every time we think we're out of the woods, we're not, the woods get bigger. And one of the things I've been noticing as well is an amazingly rapid increase over the last couple of years of school refusal. So I've done this, I've done this lecture with more of a clinical bent, and I really was talking about this over the summer. I anticipated that the return to school was going to be very, very disruptive. Kids had not really been in school very much for a long time, and schools just kind of had this normalizing philosophy of the bell, come back, the bell rings at 8, go to math class. There was a lot of guidance on public health. There was very little guidance to schools on mental health, that clinicians sort of saying, hey guys, let's titrate people and let's look at what the science says. You need to do exposure response prevention so that people, it's like getting into a cold pool. You have to do it slowly to habituate. And nobody was thinking like that. I think the rush back in was very difficult for a lot of people. And a lot of the issues that were sort of you didn't see in the woodwork came out, and that's what we saw in the fall. And I'm hoping that we're closer to getting to the other side of this. Again, the other thing that we've noticed pervasively, it's pretty axiomatic that any chronic kind of mental health issue comes with executive dysfunction, and I sort of plant that seed with Dominick as well to comment on that, maybe from what he's seeing in testing trends. So just think about working memory. Working memory is our short-term memory. It's like where we store information that then we stick in our head. So learning, without working memory, you can't really learn, because if you don't store it, you can't retrieve it. You really haven't learned it in lots of ways. So if you think of it as like your hands, you can only hold a certain amount of information. So think about it. Everybody here is an adult. Like think about when you were 8 years old, what your phone number was, 772-3643. You remember it. Like, so when you have a lot of anxiety, worry, just stuff going on, it's literally like takes up some of it. It's like you're holding something in your hand already. So kids are just have less room to hold information on a kind of like global scale. And so again, what I'm seeing in education, and I'm trying to implore educators to understand, you have to be aware everybody's having a little bit of a harder time learning. They're literally, it's almost like two people talking to you at once a lot of the time, because there's so much working memory that's compromised. That's for any kid. That's for like the most typical of kids. We have to be thinking about these things educationally. And the other thing, just a couple of points I want to make to frame this issue as we move on to the next panelist, is to talk about what the research has been indicating in terms of mediating factors. So many kids who did not have adequate coping skills really suffered. And so the lack of positive coping skills was probably the single most important factor that everybody has noticed in their research, that, you know, positive coping skills is a tremendous mediating factor that supports mental health. So kids who did not have those skills or did not have access to develop those skills really didn't do well. So again, these are the things that need to be integrated into our responses to the pandemic. Addiction was another significant concern for adolescent mental health during the pandemic. And again, I'm seeing all this in my work. So due to stay-at-home orders, school closures, or new at-home learning methods, students are seeking ways to connect and socialize in manners that may not be productive for optimal health. And I have to admit that my son, who's 18 now, he really stayed connected due to Xbox. I'm like, this is great that he's socializing. But when that becomes less adaptive, we saw an amazing increase. And again, I think this is going to go on. The footprint of the mental health impact will go on a lot longer, I think, than the public health footprint. Smartphone and technology addiction has become another really significant issue. Again, whether it's substance addiction or technology addiction, both forms of addiction lead to poor mental health outcomes for adolescents. And there was, you know, a rapid increase of drug and alcohol use in adolescents during the pandemic. And it continues. I think a lot of it continues because the pandemic's continued, but every time Mother Nature, again, keeps on moving the goalpost, it makes it harder and harder for interventions to stick. 49%, almost 50% of, you know, one of the larger meta-analytic studies I read of the kids who are showing signs of addiction were just doing drugs. And so we're seeing a lot of concerning behavior. So my question is, I'm sort of rapidly went through a lot of just things to think about and some of the findings, but are people, parents and professionals, are you seeing these things? Are they resonating with what you're seeing in your kids, or people are resonating with people's clients in terms of mental health regression, social regression, academic regression, developmental regression? Those are sort of like the three lenses I've been looking at kids through as we sort of find our way through the pandemic. So, and we'll pick that up at the end. I'm going to turn it over to Dr. Auciello, and I'm excited to hear what he has to say from his specialization view.
Thank you very much, Evan. It's nice to be here tonight. So I'm a neuropsychologist, and primarily I conduct neuropsychological and educational evaluations with children and adolescents, and young adults as well, but mostly kids and adolescents. And the whole emphasis is supporting educational planning and figuring out what kids need in the classroom, outside of the classroom, and at home. So in terms of the things that we typically cover, whether there's a pandemic or not, we want to know about a child's intellectual functioning and their important cognitive skills, like their ability to use language to reason, their ability to problem solve. We're very interested in a child's language development in terms of how well they understand what's being said to them, how well they express themselves. Attention is something we look at from multiple angles, both direct testing, observations in the classroom, in the office, and what parents and teachers have to say about the kids. attention, and other abilities in the context of their daily life. Executive functioning is something that neuropsychologists in particular go into. So that includes areas of self-regulation, how well a child manages their emotions, how well they regulate their behavior, as well as how well they manage tasks. So using their working memory to follow instructions, to see tasks through to completion, how well they initiate tasks and plan and organize what they need to do, and how well they keep themselves physically organized as well. Learning and memory is another essential component of a neuropsychological evaluation. And that spans both the immediate working memory, which I like to think of as your desk space, what you're trying to hold in mind in this moment, as well as other aspects of the memory system that have more to do with your file cabinet, storing information that you learn, retaining that, coming back to it at a later time, and whether or not the kid can pull that information from the file cabinet, or do they need some cues or assistance to do that. We look at motor skills, just usually associated with handwriting, drawing, copying. Of course, we're looking at academic skills development, so reading, math, and writing, and from multiple levels. Just as an example, for writing, we want to know everything about from handwriting to spelling, how well the child writes sentences, how well do they write an essay or a story, if they're old enough for that. And then it's also important to consider the child's social, emotional, and behavioral functioning. We integrate all this information together into a sense of the child's strengths and what their challenges are, and that informs what their needs are, of course. So just as some background in terms of the pandemic and emerging from it, mostly or partially, doing evaluations, there was a lot of debate when the pandemic first hit and you could not see kids in person. So there was debate as to whether or not evaluations could be done remotely. I was in the camp of doing remote evaluations and just doing our very best to do what we could to identify problems and get families connected with support. So it wasn't ideal seeing a kid through a computer who was at home, but you could still figure out if the child likely had dyslexia and if they needed to meet with a reading specialist in order to get started and with intervention. So the evaluation process morphed into, for me anyway, doing evaluations in a remote in-office setup, where the child would be in one room and in the office, and I would be in another room, and we were communicating through computers, but we weren't breathing the same air. And the kid was in a more structured environment than they were at home, which had its challenges for some kids in terms of engaging in the process. And now, as things have gotten better, we're in the office face to face, depending on the kid, depending on the circumstances, depending on what we're trying to accomplish. We may or may not be wearing masks. I sit a lot in my office with the window wide open and a heater at my feet, so we're getting fresh air and trying to keep reasonably warm on a day like today. So, it's been a challenge assessing kids, although, I think that it's always been possible to point families in the right direction. Throughout the evaluation, the other role that I've played is just trying to help families problem solve issues. So I'm a provider of the collaborative and proactive solutions model, where, we try to get information from kids about what's difficult for them and why is that difficult for them? And it's very different than saying, well, you're having trouble checking your Google Classroom in order to get your math homework done. We're going to reward you if you could do it, and we're going to punish you by limiting your screen time if you can't. And instead, if you really ask kids in a detailed, deep way about why something's hard for them, you usually find out it's not about motivation, but it's about something making it difficult for them. That they're, in this case, so many kids struggled with the multiple different types of technology they needed to use, different applications, different teachers who had different requirements or would post things in different ways. One teacher might be emailing their kids the homework assignment. Another one, posted it on Google Classroom. And so when you find out from the kid what's making it difficult for them, then you could work towards a solution that the solution itself helps the kid get the task done beyond any sort of, reward or punishment. I've found that anecdotally, just in the kids that I've evaluated, there have been a minority, but a significant minority, because I heard it, a good number of times, who did better with remote learning. In many cases, because they found, at least under their particular circumstances, that they could focus better at home in a room by themselves than in the classroom. And that, I would hope that kind of information could then be brought back to the school when the kid returns to the learning environment, because it's just important information. The kid's trying to tell us something about what works for them and what doesn't work for them. Some kids, they just found it so much easier to have fewer moving parts, getting their materials from home into their backpack, to school, back in their backpack after school, bringing home what they needed, that there was too much to keep track of. Whereas with remote learning, they just had everything they needed right there, and it didn't move from the day before. The other theme I found was that some kids benefited a great deal from feeling less social pressure. And maybe this is a double-edged sword, because the kids then get less practice, interacting with other kids. But some just felt so much more at ease not having to be around other kids and socializing, and found it much easier to focus on their academics because of that. So I would say for many other kids, more kids than otherwise, it was much more difficult. And obviously I'm seeing kids who are having challenges. I see a lot of children with ADHD, with learning disabilities, who are struggling with reading, math, and writing. I see kids with language processing issues, kids with autism. And so I think that the circumstances of remote learning, and then also returning to school under the conditions that they have had, made those challenges much more pronounced. So when it came to remote learning, some kids just could not focus at home. The distractions around them in their bedroom alone, the fact that they didn't have the natural pressure of being in the same room as their teacher, in the same room as their peers. It was much less containing for them, and too open-ended to resist distractions. Obviously, kids suffered emotionally from not being connected with their peers, from the feeling of isolation that even if you're on a computer with your peers, it's not the same as being in person. So a lot of children I worked with would talk about that as well, just the emotional and social impact. It was interesting, as I would ask parents of younger children, how have your child's social interactions been let's say if I'm assessing for autism or just social challenges, over the past couple of years, there's so many parents who just had to say, I don't know. I have no idea. I haven't seen my child with other kids. And so, there was also an impact on just the type of information parents had about their kids. So some of the other challenges have been that parents have at times needed to intervene at home in ways that are simply easier for a teacher due to the nature of relationships. A kid, many kids, not all, but many will be more responsive to an adult who is not their parent, giving them guidance, giving them feedback, telling them what to do. And yet parents were put in this position of having to do things that, as loving and caring as they might be, they just weren't trained to do like a teacher would be. We've seen kids where it was just not possible. It wasn't possible for the family to provide the support that the kid needed, and the kid just was not able to do it on their own independently. So for some kids that I've worked with over the course of this pandemic, it's simply been impossible for them to learn, to acquire new skills, or to maintain their previously learned knowledge and skills. I would say that in my own experience, the kids with more profound issues had more profound challenges in terms of accessing educational opportunities at all. I've also found it to be interesting that parents saw issues that they never really noticed before. Let's say challenges with reading comprehension that wouldn't have been apparent to them because they never really observed their kids doing the kinds of tasks that they were now privy to. And so a lot of referrals I received, this happened so many times. I would say, well, what brings you here, and what are your chief concerns? And the parent would say, well, I never really had this concern before, but I noticed that my kid seems to not fully understand the things that they're reading, or I didn't realize that math was so hard for them. Or, there's always been some signs of challenges with planning and organization, but my kids completely, I've seen firsthand how much trouble they have. And so some things were not necessarily that the kid was having more issues, it was just more apparent to the parents at this point. So, I've also had a chance to look at some of the research that's been done. I wouldn't say I've done an exhaustive review, but there's, some themes that I found interesting in reviewing things. There's some studies that have used previous absence data, and also data from what Evan referred to as the summer slide, where you can look at, time away from school and how that impacts a child's learning. And so in using that data and in the timing of the onset of the pandemic, and then when kids were returning to school, there were predictions that entering the 2020 school year, 65% of learning gains in reading and 37 to 50% in math, that the children were expected to enter the school year with that much fewer skills relative to a typical school year if they had just completed the school year normally, had the summer slide, and then gone back to school. I would say, in my experience, but also some of the research would suggest that the students who were able to maintain the same levels of academic achievement they had are kids who really didn't have many issues to begin with and were higher functioning in terms of like their pre-COVID level of reading, math, and writing. Some of this is common sense, but it's important to look at the research because common sense doesn't always pan out to be the truth, but in some cases it does. Certainly kids with neurodevelopmental disorders, and we're talking about ADHD, learning disabilities, autism, language disorders, were more vulnerable to adverse effects in terms of their mental health. So all as a group showed a higher level of emotional symptoms in relation to mood and anxiety. ADHD kids in particular, but all groups also showed an increase in behavioral challenges. And more so kids with autism spectrum would return to school showing fewer pro-social behaviors. So a pro-social behavior might be encouraging someone or asking someone a question about themselves, or offering to help someone, just as an example. And females with autism spectrum were seen as having the largest impact in terms of increases in emotional symptoms, anxiety, and mood. Not surprisingly, in terms of how kids received their education and supports that they needed, students with special needs were certainly disproportionately affected by the pandemic. They received less direct instruction that they needed. They received fewer related services that they had previously been provided with. And there were significant gaps in therapeutic services as well that simply couldn't be provided for periods of time. And those kinds of things are still continuing because maybe things are starting to get better now, but in fact, staffing shortages are a real thing, and staff who are out sick and other staff have to cover for them. So now there's supposed to be 2 teachers in the room, but there's only 1 teacher in the room because the second teacher has to cover another class that doesn't have a teacher. So these kinds of things have not resolved. They've just kind of changed a bit in terms of how they manifest. I would say that kids with ADHD have had a particular challenge in terms of their attention span, with the autonomy that they've needed to, or that's been required of them. There's been an increase in adolescents with ADHD who experience emotional symptoms and substance use as well, which Evan alluded to. I would say that in terms of helping kids return to a better educational life, there's 2 main threads, I would say. One is that there's a lot of kids who need remediation. They need catch-up work. They either did not gain skills or they've regressed in their skills, and they need a lot of direct instruction on building their reading, math, and writing skills because of that. The other piece is taking a close look for any child at sort of the goodness of fit between where they are and where they are re-entering into the curriculum. Because if if you're just arbitrarily 30% behind in your math learning, and you are now going into 8th grade, not only are you behind, but the new learning that will be required of you is going to be harder because you have less of a foundation to begin with. So the impact actually increases over the course of the year. You're not just 30% behind 4 months later. You may very well be 50 or 60% behind because you don't have the old learning and you're not keeping up with the new learning. So beyond just remediating skills that are foundational, kids also need their teachers and parents and other school staff to be very aware of where are they in their learning, and how do we connect them with their current curriculum in a way that it's going to be accessible. And maybe that means, putting the car in reverse and backing up and not, being so far advanced in comparison to where we might hope they would be. It takes a lot of vigilance in understanding where is this kid at. We need that that zone of proximal learning where we are educating kids close to where their skill level is and leading them from there, and not being too far ahead of where they currently are. So I'm going to hand it over now to Adam for the next portion.
Thank you, Dominic. Hello, everybody. Thanks for joining this evening. As Liz mentioned earlier, I'm a special education attorney, so I'm going to present from a legal standpoint. And what I'd like to try to do is piece everything together. You've heard a lot from Evan and Dominic, and I'd like to make sense of it the way I see it from a legal standpoint, helping clients who are in this situation. I'll say that in our practice, we see a wide range of needs and diagnoses, from autism to learning disabilities to dyslexia to emotional issues, behavioral issues, depression, Down syndrome, etc. A very wide gamut. And everything really depends on the question of what's appropriate for the student. And I think one thing that the pandemic has made even more clear is that question of, is the student's needs being met? Is this an appropriate program capable of helping the child? And so that consideration has become even more important. And in terms of our practice, we represent clients who are in public school settings. We have clients who are in private school settings. I would say most are probably in private school settings. But I think one of the themes of what I'm going to share is the disparity between how a private school can respond to the needs of a child with a disability versus how a public school can respond, based on my experiences, based on what I've been seeing, based on what our clients have reported to us. And so one thing I would like to pick up on is what Evan mentioned earlier about reduced learning time having happened as a result of the pandemic, and being able to provide enriched learning time. And so there are things in motion within the public school system to make up for the education that was lost. But I personally don't have a tremendous amount of confidence in the New York City system, which is a behemoth, to be able to respond in that kind of nuanced, tailored way that you've heard Dominic speak about, that these children require. And so, we've seen an uptick in families who are seeking private school placement. I was discussing that with Evan and Dominic earlier. And I think one of the reasons is that for a lot of these families, it's become more clear that the public schools in New York City are having a very difficult time responding and providing appropriate instruction and services. And there's a lot of reasons for that. As a result of the pandemic, there's been all kinds of shortages. Dominic was talking about the shortage of teachers being pulled elsewhere and not being able to stay in the classroom where they belong. There's a shortage of therapists, all of these related service providers, speech providers, occupational therapists, physical therapists. There aren't enough of them right now. And so schools are having to triage their students to see who needs it the most, which means that the students with the most severe cases are going to be seen by that provider, but a lot of the other students who still need the service, but perhaps not as much as those serious cases, are going to get short shrift and not get the consistent effective services that they're entitled to. And so I think, when we're talking about how to make up for lost time or restore achievement, we want to be counseling parents about finding a school that's able to tailor instruction and services in that way to help students make up for that lost time. Regression has been a huge issue for many of our clients, but especially the ones who have autism. Not having adequate opportunities to interact socially with their peers, not being able to get the structure that they need on a daily, hourly, minute-by-minute basis to learn and gain skills. And so that's a really real effect that the pandemic has had. And so the conversation needs to be centered on makeup services, right? What can these families secure for children who have regressed substantially to make up for lost time? And it may need to be done in an intensive way so that you avoid the type of situation Dominick was talking about, because they're starting behind. And if it's not addressed properly, they're going to fall even more behind. So as legal practitioners, our goal is to secure those makeup services, whether the student is in public school or private school. It could apply in both situations, but our goal is to secure those makeup services as quickly as possible so that the student can start receiving that additional instruction, those additional therapies to make up for lost time. I think, one of the themes I wanted to cover is evaluations. Generally speaking, evaluations are so important. When parents come to us, we almost always recommend a comprehensive neuropsychological evaluation if one hasn't been done recently. Especially now with the pandemic, to have an objective interpretation from a neuropsychologist about what's going on with the child, what regression has there been. The neuropsychologist is in a position to speak to classroom teachers and observe the child and put together a story about what has happened and what that child needs. And so I think that's especially relevant and important now. And in-house testing at the school as well, because the classroom instructors and therapists are in a position to gauge where the child is at. And, public schools are not always in a position to do that effectively. Evan was speaking earlier about conducting those types of assessments when students come back to school to see where are they at now. And so I think you need to be looking at that piece of the puzzle as well and focusing on the assessments from the professionals who can conduct them effectively to tell a true story. Evan, when you were speaking earlier, you mentioned sleep disruption, and I don't know if you mentioned change in diet, but I think, it's true for adults who are typically developing, or let's stick with that, adults who are typically developing, disruptions in sleep and diet can really affect how we function. And so imagine for a student who's grappling with other types of challenges and they're suffering sleep disruption and changes in their diet, and it's going to exacerbate everything that they're dealing with. And so I think having a plan in place, whether that's a counselor who's going to work with the child and family on sleep habits and diet, or someone else within the educational model who's going to focus on that, that's something that needs to be addressed as well. And so that's something that we would focus on too. And I think there was some conversation about coping skills. Again, same idea. If that can be addressed by a counselor and the student is not receiving counseling currently, or not receiving enough counseling, or should have been receiving enough counseling, but it wasn't provided, and so the student is having more difficulty coping, we're going to be looking at that very carefully. And putting together arguments, drafting a complaint to demonstrate that the student was deprived of those services, and seeking compensatory services or enhanced services to help students develop the appropriate coping skills. Dominick mentioned something very interesting before, which was that one of the silver linings of the pandemic, perhaps, is that some students function better at home than in the classroom. And I think that's really interesting. We don't talk so much about some of the positives that have come out of the pandemic. And I've heard professionals talk about this one and others. And it goes to the question of, if parents are learning more about their children's learning styles, and now they're reporting that to the classroom teacher or the speech therapist or the committee on special education, whatever entity, are those people going to be in a position to tailor the program to respond to that? And so, you know, when Dominick was speaking before, what I heard was some students function better at home because there are fewer distractions. Some students function better at home because there's less to keep track of. Some students function better at home because there's less social pressure. I would like to think that if reported to a classroom teacher, the classroom teacher could respond and create a classroom for this student that has fewer distractions and more organization and more support for social interactions. And so I think one suggestion that we might make to a family that's coming to us for legal advice is to communicate these concerns to the school. Whether it's a public school or private school, you have to communicate these concerns, and you want to lean on the experts who are in your life, whether it's a neuropsychologist or a tutor or a therapist, to advocate with you and get the point across to the people educating the child that these changes have to be made, because otherwise the student can't function appropriately. Always goes back to appropriately in the classroom. And so based on my experience, private schools generally do this very well. There are some public schools that may do this well, and there are some public schools that are bureaucratic and disorganized and a lot of red tape and short-staffed and may not do it well. And so it's always case specific. You want to look at the specific program, but if these issues are present and they're not being addressed properly, parents can come to our firm for guidance on how to resolve those issues. And it could mean finding out a way to resolve them at the public school, or it could mean pointing the family in the right direction for a private school such as AcademicsWest, where they're going to do a better job of responding than a public school can. And I'm just looking at my notes. The remediation piece. I mean, from my standpoint, you know, one of the things about the area that we practice in, the federal law that this practice area is based on is very expansive, and it gives families a lot of protections and a lot of avenues for relief. And so from my standpoint, there's so many supports that can be secured to help a family where, you know, the student is struggling. And so it could be anything from tutoring to a special type of reading remediation. Linda Mood Bell, to give one example. There are other programs like it, but sometimes a school is providing the amount of reading instruction that it should be, but it's not the right kind. And especially where there have been losses, you want to make sure that the methodology that's being used is effective. And so that's something that we see often. And I think, especially now when there may be teaching happening, but it's not necessarily effective, you need to really zero in on what does this student need? What type of specific methodology? What type of therapy? Are there specific qualifications that the teachers or therapists need to have for the learning to be effective. Sometimes with speech therapy, a child might require something called prompt therapy, or with physical therapy, there's a methodology called Cuevas Medic. These are just some examples, but my point is, I think that the pandemic has presented an opportunity to really focus in on what helps the student learn. Is it happening in the classroom? And especially as parents are learning more about their children's learning styles and are in a better position to perhaps report that information to other people involved in the child's education, those are the supports that should be pursued. And one point I always try to emphasize to parents at whatever stage of the process they're at is that it's super important for them, for you, to know your rights. And just some basics, you have a right to a free, appropriate public education. And if it's not happening in a public school setting, you may have a right to find a private school setting and have it funded by the school district. And so a school like AcademicsWest, for example, I know that there are a lot of students in their program whose education is being funded by the Department of Education, by the school district, specifically because the public school system did not meet those students' needs. And I suspect that shortfall of not being able to meet the students' needs is happening more and more now because of the pandemic. And there's more and more of a need for private school placements that are able to adapt and support and do what's necessary, especially under these types of challenging circumstances. We need schools like that. And, you know, throughout the pandemic, I spoke with many families who were dealing with extremely difficult circumstances, as I'm sure is true for Dominick and Evan and the other people, the other professionals on this webinar. And I lost my train of thought for a second. You know, you hear really sad stories of deprivation and difficulties that students were experiencing and regression. And I think it's really important to make sure that the student is in the right program and consulting with the right professionals. The evaluations, in terms of knowing your rights, the evaluations are also something that should be done at public expense. And so in some school districts, they do an effective job of conducting the evaluation. In certain school districts, like New York City, they really are not very thorough. And the evaluations don't include recommendations. And so that's something else that parents should know. It's particularly relevant now when we're trying to figure out where is the student functioning, what does the student need. You may be entitled to pursue an independent neuropsychological evaluation and not have to pay for it out of your own pocket. And the other point I want to emphasize is you have a right to an impartial hearing. And so one of the protections in that federal law that I was alluding to before is to file a complaint and request an impartial hearing so that you can have your day in court in front of a judge. And so if you feel that you've been deprived during the course of this pandemic and your child's needs have not been met, you have a right to present that in front of a judge and ask for relief. And so I think typically where it all comes together from my perspective is that it's a team effort to secure those supports and services. And so if you're going through that impartial hearing process, you're going to be relying on the neuropsychologist to provide a report and perhaps some testimony. If your child is enrolled in a private school, you may be relying on the private school for testimony. If you're dealing with other providers in your child's life, they may play a role in this process as well. But you should know that you have this opportunity to present your case and pursue the supports that your child is entitled to. And you're not in alone because you have potentially your lawyer, your child's school, your neuropsychologist to come together and be very clear about what does this student need? Why are these supports necessary? What was the harm from not having them in place? And how is the student going to benefit from getting them immediately? I think those were the main points I wanted to address. Happy to answer any questions or respond to any points if there are any.
I stopped sharing the screen because I figured we can kind of have a little bit of a discussion, but thank you to the three of you. That was wonderful. Yeah, if you have any questions, please just unmute yourself and ask away, or you can also put them in the chat. We have one here already from Anne. In the context of the pandemic, how do you distinguish between stress or trauma responses and underlying executive functioning or processing disorders or learning differences?
That's a big question. I have some thoughts, but Dominic, you want to start? Sure.
Sure. Yeah, it's, it's not different than a kid who's developing, becomes a teenager, develops depression, and there's a question, well, do they also have ADHD? They're having a lot of trouble focusing and managing things from an executive functioning standpoint. So when it comes to considering stress and trauma, a lot of it is looking at the course of things. So I've seen kids where I'll ask 1,000 different ways. So was there any teacher ever over the whole course of this child's life, before they were stressed and traumatized by the pandemic or something else, was there anyone who ever said they had concerns about their attention or their organizational skills, right? So if the answer is undoubtedly no to that, that's a clear case where you're looking at probably the effects of stress and trauma. A lot of times it's not so clear. A lot of times there were red flags, and you have to think, is this an issue that's simply been exacerbated by stress and trauma? A subtle issue that's been there all along, but now it's a more significant issue. It could be also that there's executive functioning, learning, processing problems that may very well have emerged because of the increase in demands as the child is developing and getting older, and teachers are expecting more from them. So there's a number of different possibilities. How things have played out over the course of time is a good indication or helpful information as to what might be the root cause. To me, at the end of the day, the most important thing is just understanding what is the kid's functioning at this point in time, what are their challenges, and what kind of support do they need. So the student who's depressed, traumatized, stressed, and is also having executive functioning issues, we need to address all of those things. So, it's not just psychotherapy for the emotional challenges, but they very well may need executive functioning support. And over time, you might see that as their mood improves, they're having fewer challenges with executive functioning, or maybe they still need the support.
First of all, and this is something, that's a common denominator to all chronic mental health issues, is executive dysfunction. It's axiomatic. If you're having any chronic mental health, any psychiatric condition, comes with executive dysfunction. So first of all, given that needs to be included in any approach to treatment, whether it's, I built a program around the executive functioning piece because you're not going to get traction in education or therapy if you don't have adequate executive functioning. So I think we need to work on that pervasively in schools. But one thing, and trauma has become one of these words that's started to seep into the vernacular and become a little monolithic. We're like trauma, but trauma really is a very specific thing. And what we see to suss those out, stress is something in your environment causes you to react, to deal with it. And often stress with some support will result in resilience. It's actually not a bad thing. We're built to deal with stress and respond to it, hopefully. trauma is a deeper set of reactions. And when we have a lot of stress kids, we have a lot of real true trauma kids who don't necessarily develop that natural resilience. It's a deeper issue. And I always think of trauma less as an emotion and more as a reflex. And so they'll respond to treatment differently. They'll behave differently because trauma is coming from a very different place than stress. So again, a lot of this stuff looks alike. Like a lot of trauma looks like ADHD. A lot of trauma looks like anxiety. A lot of ASD looks like all these things. So, you know, it's important to get people like Dominick to really suss those things out, because how we deal with the treatment is going to be different. But all these kids share executive dysfunction. It will help their treatment, it'll help their school, help their life trajectory, just to look at just to help them on a more cognitive level.
Any other questions?
My name's Jeff. I don't have any questions, but I want to say thank you, because my child is a student at AcademicsWest, and I have a second child who is enrolled in one of the funded private non-public schools in the city of New York. And a lot of what I've heard tonight isn't new news, but it certainly reinforces that as a parent who's trying to do everything I can, I'm not ahead of the curve, but at least I'm up with the curve. And you know, the kind of questions that I would ask now are like outside of the topics already, beyond the pandemic of COVID, but the epidemic of gun violence in the city of New York, and the news headlines of today, and how that's affecting, you know, teenagers that are already nervous about going outside, and nervous and super anxious when the sun goes down. And, you know, and what I'm just very grateful is that, you know, being ahead of the curve, at least part of this collective group here, is I've got a lot of the supports in place already. And I'm really grateful for that. And I think hard about the people that don't have those supports or resources in place already, you know. And so if I were like to have a phase 2, it'd be like, what do we do for the rest of the folks that are still trying to figure all this out?
Let me just say kudos to you for putting that all in place. It's certainly not an easy process to navigate, and it sounds like you've navigated it well, and, you know, advocated on behalf of your kids and put the necessary programs in place. So that's real good. I
always feel that, like, you know, Jeff, you're not the bright, capable person. I feel I meet all these families who just are less educated, have less resources in every sense of the word. It is not easy to navigate all this. And the hardest thing to do is find the team. Like, who do I need to help me? And there's a lot of easy ways to find the wrong team and waste a lot of time, energy, and resources on it. So I hope, again, what comes out of the pandemic are more organized resources to help everybody.
Yeah. Thank you. Yeah, I agree. No, it's a lot of it's just the courage to ask for the help. You know, I can't figure it out for myself anymore. So
navigating the DOE, the lawyers are really, really helpful with just hand holding through this process. You know,
sure,
I've done it as a parent too.
You know, but I mean, I just remember, you know, holding on to the hope when my kids were little, like, you know, I don't want them labeled as special needs, even though they might come with the benefit of schooling, you know. And now that I'm finally, you know, once you cross that threshold and you're in it, it's like, I can't imagine not having the courage to ask for that help, to let go of the expectation that everything's going to be, you know, perfect with enough love and support. And, you know,
it's amazing how often we hear that from families. You know, I know from speaking with them that it can be a lot to digest at first. And there are parents who might be reluctant to get started with the process, but once they make the decision to do that, and then years have gone by and their children have progressed and they have become used to the support they've been getting from their team, they can't imagine not having done it, or having done it without the support that they received. And it truly is a team of people. It's a team.
And did you have a question? I saw that your hand was raised, but I don't know if that you meant to do that. Oh, I think you're muted.
I'm sorry. So I do have a kind of a follow-up question. I am also lucky enough to have a son at Evan's fantastic school. We're very, very happy. He's really flourished. I'm thinking actually more about his brother, who had the misfortune to have to learn Algebra 1 on Zoom and go through puberty in a pandemic. And all these kinds of issues are suddenly so much bigger than they were. And I'm wondering if you just sort of say, oh, he's having executive functioning issues now, let's get him some executive functioning coaching. Is it possible that you might miss, if you're looking at these kids and you're evaluating them on the level of functioning, is it possible that you might miss something like an adverse childhood experience, or a something going on at home, or something like that, that may actually warrant further investigation and a different kind of work?
That happens all the time. You know, we base so much on report. I mean, I can't divulge cases, but I'm currently just dealing with that all the time. Just, it's only as good as what you get from the parents and you just try to get as many points of view. And a lot of, for example, trauma is just, so I'll give you a case example. We recently had to deal with this, and we have all these social workers, psychologists, et cetera. And we just instinctively felt that there was something going on, but we weren't hearing it or getting it. And then we had our art therapist get involved, and it came out non-verbally. We got creative and found a way into it, but I think so much of this is intuition as well. I mean, yes, you want to have corroborating data. I don't just assume things. I go to people like Dominick and I want to see the data, but clinical judgment and gut is so important, because I often miss tremendous things. So that's why a team approach is great. Somebody will come up with an idea, but and parents, I find, are often disenfranchised because all these professionals are telling you stuff. You know your kids way better than us. And if you're still, Dominick and Adam, how many parents have you met that went through 1,000 people because they knew there was a problem and people weren't telling them, that were just giving them the wrong answer until they really found the true right answer because they knew that it was inadequate? I mean, I hear that all the time.
Yes, I would echo that. Parents know their kids best. There's a reason that parents are considered equal members of the IEP team. There's a reason there's feedback sessions with parents at the end of neuropsychological evaluations. So I definitely agree with that sentiment.
Yeah, and I think, in doing evaluations, just try to be comprehensive, look at things from all angles, get information from the kid, from the teacher, from the parent, from the records. So, of course, things can be a moving target, things can be complex, you don't always get things right or understand the complete picture, but that's, we seek to be that comprehensive. And also, I don't know how relevant this is to this exact question, but whatever the child's difficulty is, whatever that expectation being placed on them is that they're having difficulty with, the best source of information about why that's difficult is asking the kid. And it's not as simple as just saying, hey, why is that difficult for you? That's how you start, actually. It may take some tact, it may take some time, and it may take some expertise to get the kid to give the information needed to help them problem solve. But really, that's, to me, golden information is if you ask the kid, I noticed that getting up in the morning on school days is hard for you. What's up, right? That might be an hour-long conversation, even with a kid who you think will not even talk about it. You can get a lot of good information from kids that then helps you to figure out what to do.
Yeah. I could give so many examples, but I just can't. But it's so true.
Thank you guys so much.
Any other questions? Did someone raise their hand? Jenny, did you have a question?
Yes, can you hear me?
Yes.
So I'm a public school parent right now, and my child has had an IEP like since the beginning of like preschool. So he's been through CPSE, CSE. He's currently in 3rd grade. We just went through an IEP, and actually we're retaining Dr. Auciello in March, his team, to do a neuropsych. So definitely the pandemic has exacerbated things that already was pre-existing to worse, but it's getting a little better because, you know, of the going back into the school, I guess, learning. My questions are, I'm sorry, I joined a little bit late. So I've attended a couple of private school, and I'm new to this, and I'm asking some of my friends who already are in private school, because I didn't know that there were so many private schools that actually address more therapeutic or, you know, special needs, because I'm in the Queens area, and I think lots of the schools that are well-known and resourced, other than Summit and Queens, are actually in Manhattan. So when does a parent, like in my case, start to think about, after their neuropsych, if the public school is really not it, like to start looking at schools, applying? And I don't want to, you know, share too much with the public school setting yet, because, you know, I want to see how much we can still do with them. But I'm already beginning to think that there's so much more better options out there for my child, because he has sensory sensitivities, self-regulation concerns, executive functioning that I'm learning about. So there's just a lot of things that I just don't know if public school can actually provide. So by the time I think all this is said and done, I don't think I'm going to get my neuropsych report until maybe early June, late May, early June. So I just wanted to know, as a parent, like, when do I start retaining the attorney? If I think that the public school, they try to meet me halfway right now. It's like they're letting my son, because I try to ask for sets, and they said that wasn't really it's an option, but it wasn't a great option because he's lacking in some of the math skills to get on with his current skills in 3rd grade. So then they decided, I had a reconvene
Jenny,
meeting. Yes.
May I jump in and start
Yes.
to respond? Because I totally understand where you're at right now. And I think if you've started considering private schools, then you should already be strategizing your case. I had mentioned earlier in the webinar, I don't know if you were on at that time, that there are ways to get the private neuropsychological evaluation funded by the school district. And so with proper planning in advance of the private neuropsych, you may be or might have been able to set up funding for that so that you don't have to pay it out of your own pocket. So that's one thing. The other piece of it is all of these communications that you're having now with the public school will take on a different kind of meaning if you're planning to pursue a private school placement. And so, whereas if you were just planning to stay in that public school, it would be more of a conversation. Hey, can you make this change to my child's program? The fact that you're thinking about private school placement makes it much more strategic. And to the extent that the public school might not be doing everything correctly, you're probably going to want to be thinking about documenting those issues, because you're going to want to reference that later on if you do decide to pursue a private school placement, and if you have to demonstrate the ways in which the public school setting was not appropriate. And so, we always encourage families to, at the very least, contact a law firm early. It doesn't mean there's a commitment. It doesn't mean you're engaging in legal services, but just have a consultation. Usually there's no charge for the consultation, so that you can get information and understand how the process works. And if there are steps you should be taking right now or yesterday, that at least you know that, because every day that goes by, you may be missing out on opportunities to hold the school district accountable, I think is what I'm trying to say. And your situation is a great example of that, because There's stuff happening at the public school. It sounds like the program may not be appropriate. You're already looking to switch gears, and you need to now start protecting yourself so that if you go that route, you will be able to secure what you're entitled to.
Yeah, unfortunately, the timing was a little off because my IEP was like in early February. And then as I started to speak to some of my friends who, their children were going to private school, much earlier than my son, I just didn't know about all this other option. So I pretty much just went through the public school route. But I think, what this panel has been saying, you just know more about your child after they are, from the pandemic and other things come up and you start noticing more things. And if you're wondering if where they're learning is appropriate and helping them to become, more independent, able beings. So yeah, so I know I have a lot of work cut out for me. So I know I did have a consultation with an attorney, but I didn't get too much information. So that's why I didn't retain yet. And I wanted to see the outcome of the neuropsych. My son already went through the psychoeducational because he was due for triennial during the pandemic. I waived it because I didn't think it could be done well over the video. And he already has other evaluations, speech and, OT. So the next step I'm trying to take is to see if there's any actually other things that cannot be reported through the psychoed and, my own suspicions, but has to be validated through the neuropsych testing.
I would just add one more thing, Jenny, and this is not legal advice. I'm saying it generally that, especially with the IEP meetings, you need to be careful with those meetings because what you say and do at those meetings will be documented and could be used against you in the future if you wind up at an impartial hearing, if you're pursuing funding for a private school. And so, if you do decide to engage legal services, typically they will walk you through that process of attending IEP meetings and how they should go and things of that nature. So I just wanted to put that on your radar.
Right. No, I appreciate that. No, they know that I am trying to get a neuropsych and they actually offered that they can, get one from the, not DOE, but it's like, but I told them I found my own. So I wanted to do it myself with recommendation from people who have other experiences with who they use. So I did not want to take the DOE's offer. But the school did say, that if you wanted one, we can get one for you. And it's someone that they retain from DOE.
Thank you, Jenny.
I also wanted to ask for AcademicsWest, when you say it's a therapeutic school, how is this different than like schools like Gateway and Aaron?
So good question. There's lots of flavors. We are a therapeutic school in the sense that we are for kids with mild to moderate learning issues, but also kids who have chronic mental health issues. So those schools, for example, Gateway is mainly for kids with language-based disorders. Aaron is maybe for kids with more learning disabilities and more kids with some mild developmental issues with a larger ASD group. So we are really providing psychotherapy treatment while kids are getting their education. That's our main focus. That kids, we all have our different criteria, but we sort of are the only school that will provide therapy, psychotherapy, as an integral part of a kid's education. Not that it's available, it's actually integral. So we're kind of, think of us as like the school that specializes in mental health issues. Like my son went to Windward, they will not take kids with that kind of pathology that we deal with. They'll only take kids with dyslexia in a very narrow bandwidth. So you need to know the schools. You can join things like the Parents League and they give you a lot. They can give you consultation and there's a lot of literature available because unfortunately you have to learn all these schools. Like it's like learning it's like learning the different teams and what they do. And therapeutic is a very generic word, like blowing bubbles is therapeutic, taking a walk. What does that mean? What are we trying to treat? Is it a learning issue? Is it more of a mental health issue? Is it an ABA program or we're a cognitive behavioral therapy program? So there's a lot of nuances. You need to get some good guidance to make sure you get to the right place. Oftentimes the neuropsychologist will be very helpful with saying, this is kind of what you need. You need to pair our recommendations with the right setting.
All right, thank you very much. I did attend a few of the Parently, again, thanks to the small network of contacts and friends I have. So I started to do more research around the school offerings. But thank you for sharing that.
Yeah, there's a lot to know, but it sounds like you're on it.
Thanks. All right, we are a little over time, but are there any last questions, remarks, feedback, anything?
Thank you.
Thank you, Jeff.
Have a good night,
Thank you.
everybody. Thanks for joining. I enjoyed the discussion. Jeff, we'll do round 2, Jeff. Don't worry. Even if
Thank you.
even if it's just me and you, that's okay.
Much appreciated. Thank you.
I know you have my number. So.
Thank you, everyone. This was very helpful.
Good night.